Hi, I'm Brian Richey, Integrated Movement Specialist, Medical Exercise Specialist, Faculty Educator, and Master Trainer for Balanced Body. I'm here today to have our part 2 on posture. As I said last time, we are spending way more time in front of our computers, way more time. We are spending a lot more time doing Zoom calls and FaceTime calls, etc., etc. And when you're working with your clients online, what happens? We're sitting there, our posture begins to fade, our head begins to jut forward, and we're doing it, and we're fitness professionals. Just imagine our clients when they're in their meetings, especially when there's a lot of people on the call and they're not the one doing most of the talking. What begins to happen? They begin to sink in their chair, their head begins to go forward, right? So I wanted to give you some exercises that you can give to your clients, but that you can do yourself to help anti-zoom your posture, okay? So, here are some band exercises. Last time we went through what? We did release work, we did stretching, and we did a scapular reset, a postural reset, if you will. Now I wanted to give you some exercises with some bands. Most of our clients have bands from either you've given it to them or they've gotten it through physical therapy, fitness, some way, shape, or form, they've gotten some bands. They can be done with tubes as well. Okay, so I'm going to give you a few different things that you can do. I want to show you from the side as well as from the back, so you can see exactly what's going on with my posture. Okay, so what I'm going to have you do, take your band. First exercise is going to be shoulder extension. I'm just going to pull straight down, and as I do so, I'm going to squeeze my shoulder blades together and release. Squeeze my shoulder blades together. Simple exercise. How I'm going to jazz this up though is I'm going to hold and I'm going to do pulses. Now, most people when they want to pulse, they want to just bring their shoulders forward. I'm going to do the opposite. I'm going to focus on my pulsing coming from my shoulder blades, squeezing those shoulder blades together. From behind, here's what you're going to see. Squeezing those shoulder blades together. So I may do 20 of the straight arm, full range of motion, then 20 repetitions of the pulses. Now I've gone up to 50, I've gone up to 100 repetitions with clients before. Start easy, work your way up for more endurance. That's going to be shoulder extension. Now I'm going to do some horizontal abduction. What I'm going to have you do is come out more like a T. Okay, focus on squeezing the shoulder blades together, not just taking the arms apart. Focus on initiating the movement with the shoulder blades squeezing together, and then take the arms out to the side. So from behind, focus with the shoulder blades coming together first, and then have the arms come out. And from there, I'm going to have you do a W. Okay, our W position, I'll show it from behind because it's probably the easiest to see, is coming here. Focusing again on squeezing those shoulder blades together, bringing the backs of my hands away from or toward my back of my body. That's our W. From the side, what I'm trying to focus on, and this is what I'll tell them, is I want a straight line between my wrist and my elbows. Okay, that should be perpendicular to the ground. What I don't want to see is this. That becomes a rowing exercise, which is fine. You can do rows. But if you really want to get the external rotators, you really want to get the rotator cuff firing, you need to be into a W position where the wrists are actually behind the elbows or at least in line with them. So how I'm going to focus this is bringing them here. Focusing on squeezing the shoulder blades together. Only go as far as you can. For me, I can't quite get my wrist behind my elbows, and that's okay. It's something that I strive to do. The final exercise with the bands is I'm going to have you do an X. Okay, my X, one arm comes low, one arm comes high. Now, in this position, and in all the positions, people always ask me, where should my thumbs be? Should I be turning them out? Should my palms be down? Should they be up? Depends on what you want to do. If I'm focusing on external rotation, a lot of times I'm going to turn my palms up and my elbows back, or my thumbs back. So in this position, I want to get that external rotation. And I actually find that that gives me a little bit better squeeze in my lower trapezius. Okay? the lower portion of my scapula, I feel that squeeze a little bit more. That's me personally. Okay? You may find something different. Play with it. Play with it. Sometimes it feels better to have your arms come out with your palms down. Sometimes palms forward, sometimes palms up. I jazz it up all the time. So these are just a couple more exercises that you can do band-wise. Okay? Shoulder extension, T's, W's, followed by X. Now with the X, a lot of people are going to want to do this. Okay? I really want it to look more like this, sort of a flattened X. For you Star Wars fans, okay, more of an X-wing rather than a traditional X. It's going to be out here. And I'll alternate each time. Do you have to alternate each time? Absolutely not. Now, if you have any clients with shoulder problems, coming up into this position may not be very comfortable for them if they have a little bit of impingement or if they have a little arthritis there. Find whatever range of motion works best for them. For them, maybe here on this side, and yet this side they have full range of motion. Whatever they can do in a pain-free range of motion is fine. Don't push them to an area that's not comfortable or an area of pain. Okay? So, what do we do today? We went over those 4 exercises with the bands. I want you to practice those on yourself as well as with your clients. And hopefully, your posture is going to look a whole lot better when this is all over. I'm Richey, Integrative Movement Specialist with Balanced Body. We'll see you soon.